I'm Dr. Alan Fitzpatrick and I'm the Joint Lead Dentist here at Dentarana. Dentarana had been part of my family's life for 20 years and I was ready to pass on the ownership. It was important to me to ensure a smooth transfer for my staff and our patients. The word partner was an important one in my decision and I felt that NDC was the most suitable candidate for this role. I'd been a dentist for 30 plus years and a practice owner for more than 20 years. And I knew that it was the right time for me to be personally selling the practice. So the concern I had was choosing the correct buyer to be with me post-sale. And being such a large practice, the pool of prospective purchasers was thin, and the new owner was always going to be a corporate who would require me to remain on after the sale. Did I make the right choice with NDC? Most definitely. The challenges of being in business were the same, but now we were making joint decisions on what was best for the practice moving forwards. Clinical autonomy is paramount for NDC, with each dentist being able to choose what is best for their own individual patient. So there was no change in that aspect, both for myself and our dentists here at Dentarana. NDC respects an owner's wishes. I welcome them as a new owner, as I wanted to benefit from what being part of a bigger organisation had to offer. So there's no cookie-cutter NDC practice post-sale. Each is given the attention which the ex-owner requests. Obviously, post-sale, I couldn't make snap decisions on where money was to be spent within the practice, as I now have a partner to be respectful of. But NDC have been quick to repair and replace equipment if it fails, and if required, upgraded the equipment and provided capital investment into the practice. This has included a CEREC milling machine, which has been a wonderful addition to be able to provide our patients with ceramic restorations while they wait. Education is an important part of being part of NDC, and the staff have received ongoing training and support in their roles through online learnings and visits from the compliance team to ensure our standards are within guidelines on cross-infection control, for example. Dentarana has been able to access the group buying power which a larger organisation like NDC is able to access. This obviously reduces expense for us as a single practice and grow our bottom line. So NDC is a fabulous partner to have from that aspect. NDC have a collegiate approach to their business and encourage communication between their practices. There are state social events each year which bring all practice members together to spend time with the NDC's leadership team. There is also an annual summit which brings together the lead dentists of each of the practices, which is a wonderful learning opportunity. As a practice owner, we tend to outsource various aspects to operating a successful business. Items such as marketing, IT support, insurance, recruitment of new staff are aided by NDC, which relieves some of the burden of being a practice owner as well as providing care for patients. I was invited to be part of the Clinical Advisory Committee, which has been an opportunity to provide a voice alongside the representatives from each state on how us clinicians would like certain aspects of NDC to operate. We look at various dental materials and techniques which we pilot before they're rolled out into the broader NDC community. NDC realises the importance of the role of the dentists, oral health therapists and hygienists in the success of the organisation, and therefore provide regular opportunities to discuss the workings of the company, which is important for the management team.